Oh, honey,
That's
and
what
I
she
did.
said.
Sun's good enough anyway.
How old is the son? He's 75.
Did you see that girl on the news here at, far out? Combine that burnt down?
Happens every year.
You were about that. Like in
I can't believe how fuel fires they get.
I went to Atlanta. All this
Like it's thrown up underneath the machine and they'll keep cleaned out.
Yeah, that's great. Oh, everybody go to sleep.
Oh, none of that.
Oh, my God, I took everything I had to get here today.
Well, you can take a nap.
I did work like 17 hours Saturday.
Whenever you're ready, just give me a heads up and I'll have IT start and everything. You ready to go? Yeah. Fred? Okay, I'll go ahead and start the recording. By being present, you are giving consent to be recorded. And we are live streaming just as a reminder. Whenever you're ready.
Okay, good evening, afternoon. We'd like to call to order the Macon County Board of Health meeting for September 21st, 2021. Roll call, please.
Sandy Clevenger. Present. Vivian Goodman.
Present.
Jan Hyatt.
Present.
Debbie Hill. Here. Dr. Brett Jervis. Sue Fowles. Dr. Venkat Maniganti. Dr. Janet Patterson. Mark Scranton.
Here.
Cody Parks.
Here.
Jeff Emler.
Here.
Are there any changes to the agenda? I do not have any. I don't know if any board members have any.
I had a couple things that I sent to Brandy about, but I think she's covered most of them on the agenda except one item. I'm not sure if it's a open meeting discussion or closed meeting discussion, so. The only thing I had.
If it's regarding a board member, it's not closed.
Okay.
It's not allowed in closed
Okay.
for that topic.
Okay. Then I will entertain a motion to approve the agenda topics.
Motion to approve the agenda topics. Second.
And roll call vote.
Sandy Clevenger. Vivian Goodman.
Approved.
Jan Hyatt. Debbie Hill.
Approved.
Mark Scranton.
Approved.
Cody Parks.
Approved.
Jeff Emler.
Approved.
Motion carried. Is there any public comment?
No one is here and we did not receive any via email.
Moving on to the approval of previous meeting minutes. Board of Health meeting minutes from August 17th, 2021. Were there any corrections or? None, I'll entertain a motion to approve.
So moved.
Thank you. And roll call vote.
Sandy Clevenger. Vivian Goodman.
Approved.
Jan Hyatt.
Approved.
Debbie Hill.
Approved.
Mark Scranton.
Approved.
Cody Parks.
Approved.
Jeff Emler.
Approved.
Thank you. Motion carried. Moving on to the Board of Health Finance Committee meeting minutes for September 7th, 2021.
Motion for the minutes of the finance meeting.
Thank you.
Are you going, I'm sorry. For the special meeting minutes you said?
For the Finance Committee meeting.
Okay, my apologies, I was going in order of the way it was listed. So we just did the special meeting minutes?
No, that's next.
Okay.
So, this was the finance committee meeting.
Finance Committee, yeah. So we have a motion on the table. Second. Okay. And a roll call vote.
Did you give the second motion? Thank you. Debbie gave second motion.
Okay.
Alright, Sandy Clevenger. Vivian Goodman.
Approved.
Jan Hack.
Approved.
Debbie Hill. Dr. Macon Johnson. Mark Scranton.
Approved.
Cody Parks.
Approved.
And Jeff Emmer.
Approved.
Motion carried. And then approval of the Board of Health special meeting for September 7th, 2021. And a motion for that.
Motion to approve.
Thank you.
Second.
Thank you.
Madam President, I'd like to note that we might want to make a correction to the minutes for this meeting. I just was reading through it and noticed that the vote on the budget drill was listed as being 10 yes and 1 no. And that, I believe, is an error if I'm correct. We only had 10 people at the meeting that night, so it should probably be 9 and 1.
That is correct. I made that error.
Okay. All right, any other corrections?
Which one's
Did you get that, Lucia?
Yes, you're right.
Oh.
We have two revisions, so the date, the 17th, it should be the 7th.
Oh, okay.
So I'll fix both of them, I'll fix them on the date.
All right. Thank you very much for that feedback.
Thank you.
Okay, so we had a motion in a second to approve with corrections.
Yes, ma'am.
Okay, so a roll call vote, please.
Sandy Clevenger.
Approved.
Vivian Goodman.
Approved.
Jan Hack.
Approved.
Debbie Hill.
Approved.
Dr. Macon Johnson. Mark Scranton.
Approved.
Cody Parks.
Approved.
And Jeff Emmer.
Approved.
Motion carried, thank you. Communication, board education, Brandy.
Okay, so for this month, there was no separate special topic, but as usual, I just wanted to give a COVID update. So our numbers in the last few days or so have been down number-wise. Positivity rate looks a little bit down as well, depending on what source you're looking at. IDPH and CDC have different time frames, so it's looking to be about 6.9 to 8-point-something%. So hopefully we'll continue to see a downward trend. Hospitalizations are still a little high. We spoke with the hospital and they said they can't say that they're down at this moment, but hopefully we are in a downward trend. However, in the month of August, for the entire month, that was the most cases that we had seen in 1 month for the entire fiscal year. So that was definitely something to be noted. We are awaiting some more information from ACIP on the boosters. So right now we're kind of just waiting as far as our agency on that, but also planning ahead. We're also planning for the pediatric 5 to 11-year-old vaccinations and being prepared for that once it is approved to be able to give. Contact tracing has remained busy. We have had some additional staff that have left just for different types of personal reasons. And so hopefully these numbers stay down. If you recall, I did inform you that we had made some changes to our processes with schools. I think we're starting to see some of the administrative burden, red tape part for us and the schools go down a little bit, hopefully, with those changes that we did make. It's still a big workload, obviously, for us and the schools with everything that has to be tracked. So we continue to partner with them. We did meet again with the superintendents of the public schools throughout the county last Thursday. And so we did speak with them about the process, answered any questions that they had, clarified things, and also just reminded them if they have any kind of quality improvement recommendations that we're definitely open to those. Last week, things kind of felt like they were spiraling a little bit in the way of schools because what was happening in other counties started happening here, which was one, parents pushing their kids back into schools whom had been exposed and potentially infectious and who should be quarantined. And there was really nothing that the schools at that time could do. And then without legal support from the state attorney's office, there was really not anything that we could do at that time. And so this again has happened in other counties. There have been cases that actually did go to court with the state's attorney's office, and it did take a significant amount of staff time on the part of the school, the state's attorney's office, and the health department to even make that happen. Several cases were lost that were similar to that. So we did start seeing a lot more parents pushing their kids back in last week. And then also we started seeing some of the temporary restraining orders against masks starting to be filed here. And I know the ones that went Friday, they ended up being dismissed, but more were being threatened to be brought. So we've been talking with a lot of administrators across the state and also talking with the state, asking for additional support with these things. And so they did issue that executive order on Friday, which talks a lot about the authority of the schools to exclude children who should not be at school. And so hopefully that will help. It's brand new. We're still waiting for the rules to come from the state. They told us yesterday that we should get them yesterday or today, so hopefully we will get those. But the schools did get them via ISB on Friday. So some of them have already been able to move a little bit on that and communicate that to their communities. I think some schools are considering offering test to stay. As a health department and county, we have not recommended or supported that. The reason for that is, one, we are in high transmission and you're not supposed to use test to stay in high transmission. And then also our medical director has advised basically against that. However, if the schools choose to follow that, there's nothing that we can do. So it's basically, if they decide to do that with their legal and all, then, you know, our hands are out of it, basically, other than completing all of our contact tracing duties. So that could cause some additional confusion if a school is telling kiddos they can test and stay in school or test and come back to school, and we're telling their parents they can't come back until at least day 11. But that is the course that we are on at this current time. We have encouraged the schools to sign up for the testing programs, whether that's SHIELD or another testing program that is EUA, has EUA and CLIA. And so there are some other ones that the schools could use. We've encouraged them since the summer to sign up for those, and then if and when SHIELD testing could be allowed, that they would be able to offer that in their school district and be prepared. The other thing we've been dealing with a lot is the mandated vaccinations. And so obviously we are subject to that as healthcare workers, plus having over 100 staff. So we've had to do a lot of logistics to figure that out, to make sure staff have the time to go get tested and how we're tracking results and what we're doing. We've worked directly with our HR attorney, which is Ed Flynn, through all of the specifications of how that needs to be done and doing it the right way. So we did start that this week because that's when it was due to start. And we have also been talking with schools and then local testing sites about helping the schools get compliant with that as well. If you aren't aware of it, staff with employees over 100 or healthcare organizations, and then there's a longer list, but those are the ones that apply to us, have to be vaccinated. If they don't choose to be vaccinated, they have to get tested at least once per week, and then that's a way for them to remain employed. So we obviously have had a lot of questions from staff about this, especially staff that don't want to be tested. So I'm hoping that we don't lose anyone over it, but it is a mandate. We do have to follow it. And again, like I said, I consulted with legal, so trying to make sure we're doing it all the right way. So I know that Mark had presented some questions to me and things that he wanted to have me go over. Schools, I don't know, Mark, if you had any additional questions.
Well, I think you answered some of my questions. I know I wasn't able to go to the meeting last week, unfortunately, but I know DPS had some conversation at their school board meeting. I know there's a couple of school boards meeting tonight, and I know this is one of the topics to talk about. One of the things I had this week actually happened with one of my own employees that works for me, was very, very confused. And I couldn't answer the question for him. I said he needs to call you guys, and he was having difficulty even reaching anybody to get an answer. But he had a daughter that was contact traced, and she was not in close proximity to the person that tested positive, but yet after she showed no signs or symptoms and also went and got a test taken, they were sitting on the fence on what they were going to do, whether they'd let her come back to school or make her wait 10 days. They sent us up to the health department, and this is an interesting situation because the school district happens to fall in the boundaries of both Sangamon and Macon County.
Mhm.
So Macon County ended up telling one thing, Sangamon County ended up telling another, and it was like, what am I supposed to do? So there's definitely a lot of confusion out there, and there needs to be some clarity, I think, with the health departments disseminating information out so the message is consistent. Because this particular case, it wasn't the same. Both health departments gave two opinions, and finally, the school district got a letter directly from IDPH as to what the status of it was, and they said, you're gonna stay home 10 days. So I just want to share that with you.
Right, and I was aware of some situations, or one, I don't know how many it was, but of that school district, and that there are two counties, and it's not that health departments aren't talking to each other, because we definitely are, but counties, they may be at different levels of transmission. Counties may have different medical directors. It can be different in every county. ISB and IDPH offer 4 different quarantine options to be used in schools. And so then in that local jurisdiction, it is determined what would be recommended or supported by the health department. So in Macon County, we are very clear that we've only done 14 days or 10-day early release if they meet the criteria. But there are some counties that are doing test to stay. We are not. We are not even eligible to do test to stay right now, according to the guidance, if we're going to be compliant with it.
What is test to stay?
Test to stay is a quarantine option for release that if a child is exposed, then they are able to stay in school if they remain asymptomatic and if they test on days 1, 3, 5, and 7. And obviously they would have to have a negative test all of those times. And really, when this all started and that initial decision was made, there wasn't even a school in our county that had a robust enough testing program to even do test to stay. So we have told them, we're not saying it would never, be a supported option, but first of all, we don't have the testing, you don't have the testing in place at your schools. And second of all, we're in high transmission. And like I said, I consulted with IDPH on that and with the medical director on that, we partner with for Macon County Health Department. So what we tell someone may not be the same, which definitely causes confusion. I understand that, but it is kind of the nature of the beast. And county administrators have talked to the state about that and how it does cause confusion. And another thing is, if someone's contact traced at the school, so what that means is they're not conducting all the contact tracing process like we do. What they do is they have to determine who is close contacts to that positive child or staff member. When they determine that, if whoever meets that criteria, they submit a list to us. So if we call someone and contact trace them and tell them they're quarantined, if the school excludes someone, unless they're doing something different than what we are doing, that person was in close proximity to a positive person. So the list doesn't come to us as just hey, this person attends the same school. It's they were within 6 feet or 3 feet if they're both consistently masked, and they've been determined to be a close contact. Another point that I want to make sure to make, especially for kind of looking to the future, is with test to stay, in order to do that, the school has to ensure that there is consistent and correct masking for both parties. So it would have to be the positive person and then the contacts. So if they're not wearing the mask correctly over the nose, over the mouth, then you don't get it. Like you can't do test to stay if you're not masking correctly. So if it becomes an issue of the mask mandate's gone or a school is not enforcing the mask mandate, they also would not be eligible to do test to stay according to the guidance.
Does that put the school district in a liability situation then?
I can't speak to that. We have encouraged them many times to talk to their own legal.
Okay.
Yeah. And I do not give them any kind of legal guidance. I tell them this is what the health department recommends or supports, but we encourage you to speak with your own legal.
I had one question all the way back to the beginning. You said August numbers were a little bit higher and September start to trend down a little bit. But what numbers do you use the percentage of population in Macon County? So the 6.9 is a percent.
Yeah, we look at it's test positivity. So the percent of how many tests are done to end up being positive. So when we give numbers, like if we're giving a percent and we're reflecting percentages, we're usually talking county level or region level. Now, as far as actual numbers, when I say that the numbers were highest in August than in the entire fiscal year, I meant like cumulative number of total positive cases. So when I say that it was the most cases in 1 month than it has been for the whole fiscal year, that means number of cases, not percent positivity. Our percent positivity was also very high in August. We were up in 12 and 13%.
So to look at the number of positive tests per day is not a good metric?
It can be, but it doesn't tell the whole story. Just like if we say, there's 50 cases today, but last week there was 132 in one day, it doesn't tell the whole story because it does depend on how many actual tests were done. If you have,
How
you
many
wanna
of them
speak to-
actually want to come and get tested? I mean, is there are some patients that have, individuals that have the symptoms, if they don't come for testing, you're missing on these things, but in this case, positivity rate is one thing that's one of the standard metrics that have been used for the last year and a half.
and one thing that we're probably going to see is now with the mandatory vaccination or testing is more people will be getting screening testing that were not being tested before. So you may actually see a decrease in test positivity, but that doesn't mean that there's less people overall that have it. But there will be a lot more tests expected to come through on a daily basis because there's more people getting tested that weren't getting tested before unless they were symptomatic in
And
some cases.
Is the Shield test the saliva test?
Yes, it's a saliva PCR test.
And will all the schools have these now?
All the schools will not have it if they don't sign up for it. So that is the testing that is being provided by the state, free to the schools if they meet certain criteria. And that was the one that we had encouraged them to sign up for because it was going to be a free resource. Some of the schools, most of the schools at the beginning of the year weren't even expressing interest in signing up. There are some now that are basically in the pipeline of getting signed up, but it's several weeks out, and that's on Shield. That has nothing to do with the health department. But I know that they are trying to increase their speed of getting schools set up, but they got bombarded by a lot of schools and then also community testing sites because then there was this mandatory vaccination and mandatory testing. So then suddenly the need for testing grew significantly. So I know there are some other testing providers that are offered. They have to have the EUA and the CLIA in order to be allowed. I know there was a school in town that was looking at one out of St. Jude's. And so they don't have to use Shield, but that is one of the resources that is available. I know that Crossing is also partnering with some of the county schools to go out one day a week to test their unvaccinated staff because obviously this mandate happened and we all had 5 seconds to get compliant with it. And that is one way that Crossing is assisting those schools to ensure that that testing gets completed.
So Brandy, if they start doing the Shield testing, who are the schools that are going to be charged with the responsibility to administer those tests?
Well, so Crossing is going and administering it right now. That's what they're doing. If a school signs on themselves, it depends. It's specific to the school because it can depend on how many people they're going to be having tested because there have been teams from Shield that have been able to assist, but not all schools qualify for that based on number of students, et cetera. I don't know all of the numbers that they have to hit in order to have the staff. Otherwise, it would be staff at the school that would have to implement it. So Shield works directly with the school.
So anybody that's got a skill in administering this, talk to the school nurse, principal, secretary?
You have to be trained, but the PCR saliva, and again, I am not a testing expert, so I don't want to speak completely to this. I'm happy to, share out information if someone wants it, but the Shield PCR test is basically they spit in a tube and put the lid on it. So I know that there is training that is done in order to administer that. I don't know how extensive it is because I haven't been trained and we're not doing that here at the health department, but it is a fairly simple test.
Okay, just not to really get off track here, but they spit in the tube for this test?
They don't, hawk a loogie, but they dribble their saliva.
How big a tube are we talking here?
They dribble saliva into a tube.
I'm just envisioning, just trying to get that into a small tube and you got stuff on the outside.
You get a funnel. It's a very controlled situation. You dribble your spit for as long as it takes you to dribble spit until you get to the line. You put the lid on it and turn it in.
Is this the same test that Richland's been using for a year?
It is.
Okay. Am I right, a year?
I don't know exactly how long they've been doing it, but yes, for a while.
All of 2021.
Originally came out from the University of Champaign.
Yes. Mm-hmm. Yep. The U of I does it, and it can be a very smooth operation. So
It
again,
just sounds challenging, versus getting swabbed or something.
None of our scripts like that, Mark.
well, I will say, I had to go to a shield testing site and, it did not seem, I don't wanna, undermine the work that anyone's doing, but I mean, the spitting part does not seem very complicated, complex. It was well spaced out, so you don't have each other, and it's not like you're spitting, droplets into something, it's just
It
very.
just sounds like an airborne or something, but almost.
It's very controlled, yeah.
Okay.
So, one of my other questions I had, and you said to ask this during the meeting, so I guess under COVID update, it's a good time to say. So I know we talked about in the budget meeting, we talked about, what the plan was long-term as far as how we would continue to fund people to stay on board for contact tracing. I mean, is that gonna be, continuation of absorbing that in the budget as long as it's necessary in the taking money out of the health fund then?
So the answer pretty much is the same as far as that would have to come to the board at that point. What I will tell you is last week, again, the state said that there would be additional funding, but they haven't given dates and they haven't given amounts. Obviously, every administrator wants to know, when are we getting this money? How much are we getting? Because we have to be able to maintain operations if the expectations are going to remain the
Well, we've
same.
got 60 days to have something available and have a plan in place. If not, we're gonna start absorbing the cost of this, right?
Yeah, if we kept the people on staff, and I think that that would be such a large decision, and obviously funds to come out of the health fund, that would be something that the board would have to be involved in, not just me. I will tell you though, a lot of times with the state, we do find out these types of things very late in the game. So it's very likely that we wouldn't know until December what we're getting, how much we're getting, when we're getting it, what are the rules associated with it. So yes, having a potential plan of, are we gonna continue to contact trace, if the expectation is there, will that come out of the health fund, et cetera, is definitely something I think to plan ahead. And that's why last month I said I would like for you to think about that, because that would be a board decision, not just my decision, but also there's a very good chance things could change significantly by December, anything, let alone December 31st.
Well, I think it's something that we as a board need to be having a discussion about, and we can discuss it tonight, or we can wait another month down the road to have the conversation again. But my concerns, I guess, that I have about this are twofold. Number one, funding it, but not only that, I think Sharice, you guys had alluded to 30 to 40 people currently on payroll. Is that correct? That are doing contact tracing still, that are being funded. So I'm looking at it as an employer. If I got employees that I want to keep, number one, they know potentially money may run out, and so they're saying, hey, am I going to have this job? Do I need to be looking for something else? At the same time, I don't want us to delay, what kind of direction we want to go forward with, because these people may leave, and now you got to go back to recruiting people. As difficult as it is everywhere right now to find people to hire, this could be very detrimental to what you're trying to accomplish with this. I mean, you could lose people literally overnight for any number of reasons, but in this particular case, if they anticipate they're going to be out of a job by Christmas, then they're already going to be starting to look for something else without some kind of assurances from either the board that we're going to provide the financial support to continue this, or you find out that it's contingent on grant funding. That really leaves people kind of up in the air. And I'm concerned about that, because you're talking about having to find people and train them and everything else, and that's going to create a snowball effect, I'm afraid, if we don't try to be proactive on this. And I mean, we're sitting here at the end of September, and if we have only got 2 months left of money, basically 3 months. But I know we're going to make a decision before that. We can't wait till the end of the year and say, well, we're out of money now, what are we going to do? So I would think by next month, I would think as a board, we need to be coming up with an idea, a recommendation to the administration, what we want to do going forward, because this has to be funded somehow. If we choose to fund it, if we don't fund it, then it's going to run its course. There won't be any personnel anymore. So I think it's something we need to consider.
Yeah, I think that's well said. Maybe it's back to Brandy to give us your thoughts on how we proceed. Are we jumping the gun? But as a board, can we help to develop some guidelines or assurances that?
How about we put it on the agenda for next month? You may hear from IDPH or before then as far as the funding. But I think next month would give us still enough time to discuss it.
I think, Madam President, that would be great, and then we can be prepared to vote if necessary to support a resolution to provide funding for a period of time that would be agreeable by the board in the interim, because we may have to bridge a gap. I mean, if Brandy finds out in November, we're gonna get money in February or March, for example, okay, then do we want to supplement that gap between the time that the current grant expires and a new grant kicks in? Because again, you're going to lose personnel.
Well, the grant, we've repaid the money back.
Yes, typically, every grant I've ever been involved with, by the time a contract's signed, they go back.
So if you
To
send
the
the money out of the
start
budget, they'll refund it more or less back.
I mean, I can't guarantee
Yeah,
that,
yeah.
but typically
Normally
that
it's
is
that
how
way.
they work, because
I'm just worried
they're
about
always
losing, I mean,
running behind.
I'm just worried about losing people.
Well, you got Walmart.
I mean, she's already cut it in half from what it was.
Walmart, they're offering $19 an hour right now.
Yeah, and there's a lot of opportunity out there to pursue other jobs. And you may end up with a handful of people if they don't know that we're thinking about this.
Well, I do want to say, before we switch to the next thing, we have communicated a lot with our staff and been extremely transparent with them from the moment that they interviewed, basically telling them that this is a temporary position. The grant is expected to end May 31st back then, but of course it could go longer or shorter. And even, since then, we have communicated with them and been very transparent that we want them to stay. They're a very valuable part of the team. We couldn't do this without them. And that, as soon as we hear more about funding, that we will definitely, inform them of what that information is. And also letting them know that IDPH can change expectations suddenly. So I do think it could help to give them some assurances, like if contact tracing expectations continue, then the board is going to fund, the positions. But also knowing and being honest with them that the state could say on December 28th, December 31st, you're not contact tracing anymore, it's over. You know what I mean? So I do want to be really honest with them, whatever we do pull out of that. I'm just saying that now so that it's not forgotten next month. And I made a note for myself to put that on the agenda, but I do want to make sure that they continue to be told, and I'll make sure of that, because I speak with them, directly, that things can change. They know that. So I do just want to make sure that's reflected in the plan.
Do they ask a lot, or do they ever ask?
They do ask. Mm-hmm. Yep. They do. They asked more, obviously, when we were getting, closer to deadlines, but I just kept talking to them and kept explaining to them. And like I said, we were very real and honest in their initial interview about what this was probably going to look like, because we've been in public health dealing with state grants for a very long time. So we know how it can work even not in a pandemic.
Are
So
they mostly temporary? I mean, are they doing temp service or anything like that? They
No.
just are off the street?
we hired them, but they did know, it was a temporary grant funded position. A big bulk of them are part-time and have full-time jobs and work this as a supplement. We do have some full-time people. So, obviously definitely don't want to lose any of them full or part-time, but we don't want anybody leaving because they're looking for something else. And we've had people that have done that, and understandably so, yeah.
How do you have, Randy?
I want to say we're probably between about 30 and 40 right now that aren't part of our regular team, I think is where we're at right now. Because we have some people hired through the grant, or who we initially hired with the grant, but we're funding them not only with the contact tracing grant, but there are positions that are partly funded by that are going to be permanent positions. So they are in the budget, for FY22 regardless of what happens, but the specific contact tracing staff, once these expectations are over, then they will not stay unless they apply for a different permanent job in the health department. Our regular nurses would continue contact tracing, which is something that they do all the time with other things like, TB, STIs, mumps, anything like that. So our regular nursing staff handle that on a regular basis, but these contact tracers who were specifically hired for COVID, their positions would end once the expectations end.
How long does it take to train? Like, it's about the street, they know nothing about it. How long does it take to train to do what they do?
Well, we haven't done that in a while, but what our goal was when we were hiring was wrapping everything in 2 weeks. And that would include all health department training. So there are a lot of required training that any of our staff have to complete, whether they're full or part-time. So that would include that plus the contact tracing. Now that's just to get them going. We also, when they first started, tried to do some job shadowing, some phone calls together with like someone of a supervisory level or someone that was a little bit more tenured to be doing contact tracing before we just kind of pushed them out by themselves. But it's about 2 weeks. And then just to do standard contact tracing, we do have staff that were trained with the required training last year before we were allowed to hire anyone because we didn't have grant funding yet. So those people took all of the required training and basically are qualified to contact trace. Now we have this online program called Salesforce, and it's a much more complex creature than it was last summer. But if we did get in a position where we did have to surge, then we do have that, those people that have been trained. And then we also have the Surge Center that's funded by the state. And I think we talked a little bit about that last month, but just to kind of remind you, that's staff that are hired and funded by the state. They conduct contact tracing through the Salesforce program. And the purpose of them is to basically help counties who don't have contact tracers or not enough, or if they're surging in that county. We have honestly experienced a significant amount of difficulty in using the Surge Center because of things that they're not doing consistently or thoroughly. So our team leads have been in constant communication with their leadership, and I've been in communication with IDPH to try to just fine tune some of that. It's a newer thing. It's not super new, but you know, everybody's human and everybody's learning. So we're working through some of the glitches with that because that has caused some problems locally of people thinking that's our staff. And there's been some customer service complaints. There's been some days that have been given wrong. And then they always say 14-day quarantine. So using the Surge Center has caused some confusion. But when we have over 100 cases plus thousands of contacts in one day, you don't really have a choice. So we're trying, again, just to make that process better, not just for us, but for the other health departments using it.
Moving on to presentation of financial report. Thank you, Brandy.
Okay, the report is in your packet. It is through the end of August, and we were 75% into the fiscal year. The fund balance was at 5.4 million. Total revenue was a little over 6 million, which is 62% into budgeted revenue. And total expenditures at 5.8 million, which is 60.9% into budgeted expenditures. Any questions?
Any questions for Sherry? Seeing none, I'll entertain a motion to accept the financial report.
So moved.
Thank you. Roll call vote.
Candy Clevenger. Brittany Goodman.
Approved.
Joan Hart. Approved. Kevin Hill.
Approved.
Dr. Macon Bounty.
Approved.
Art Stanton.
Approved.
Clayton Parks.
Approved.
Jeff Edwards.
Approved.
Okay, motion carried. Okay. Department expenditures were in your packet. Did anyone have any questions about those? Not, I will entertain a motion to approve the department expenditures.
So moved.
Second.
Roll call vote, please.
Candy Clevenger.
Approved.
Brittany Goodman.
Approved.
Joan Hart.
Approved.
Kevin Hill.
Approved.
Dr. Macon Bounty.
Approved.
Art Stanton.
Approved.
Clayton Parks.
Approved.
Jeff Edwards.
Approved.
Okay, motion carried. Are there any grant applications? Department division reports were also in your packets. Do we have staff on?
We do have
In case there
some
is-
directors
okay.
on. Yeah.
So, does anyone have any questions for staff? They are on the line.
I have one for Brandy. I know we talked about this last month and you had alluded to trying to get some numbers to try to put that into the next year's budget also. I saw this literally the last time you had on your report. What's your status currently with the getting quotes for the building access entry?
So we have gotten 2 quotes I'm waiting to hear from, to get a third one. I did forward the second quote to the building commission. Since they own the building, they obviously have to be involved in any changes that are made to the building. So John, their director, is helping with reviewing those and just ensuring that they are comparable systems. So hopefully we'll have information to come, and then they are checking on the bulletproof glass or film, and I'm waiting to hear back on that. Yeah.
Great, I'm glad to hear that that's moving forward.
It is, yes.
And then I had one for Miss Wade, which I know she's online, but I'm curious as what the status is of pursuing electronic data
I can actually answer that.
information.
So I just actually spoke with Mike Baggett, Assistant State's Attorney, today because we did have some information back and I wanted to get clarification on if we had to bid that out or if we could use what we had. He did, and I haven't even got a chance to talk to Kathy about this yet because it just happened late in the day, but we did get confirmation that we could proceed, but that was literally like an hour and a half ago or so. So I plan to hopefully bring that to you by next month. Of course, we did talk about that would have to be done by resolution. If we got to that, because we needed more clarification before we could do anything with budget or anything like that. So I'm really hopeful that I can bring that to you and we can get that finalized next month.
Have you actually got any quotes yet, or are you still researching?
Nope, we, Kathy and IT have done demos, they've called and gotten information from other people who have used the systems, because it's not just health departments that have used them. They've gotten quotes, all of that, and then they've presented them to me. We've gone over a couple of times, sent questions back that we had, and so the process has been ongoing for a while. We just basically have, permission to proceed. What will have to happen with that is because it is a new contract and it's not yet in the budget, I will have to give it to legal. So we'll have to wait for them to get back. You all will have to approve it, and then it does have to go through the EEHW finance committees and the full county board. Now, not every contract has to go through that process. It depends on several criteria, but this particular one, I believe would have to go through. So hopefully that doesn't slow our process, but my plan would be to get it to Mike fairly quickly so that hopefully he can get that approved and I can bring it to all of you next month.
For the benefit of our two new board members, could you kind of explain a little bit more detail what we're talking about, how this is going to apply?
Definitely.
In regards to what Kathy's division does?
Yes. So I will say, Kathy and Evan in our IT department, they've been trying to make this happen for a long time. So it's really exciting that we might be able to do it. But what will happen first is that we will get the food program into the digital environmental health. And then hopefully that would go really well. And then we will be able to add things like septic and well in the future, but we're just going to start with food. So the inspections would be done and everything would be logged like on an iPad, basically on a device. The full report would be done during that time on the device. Hi, Dr. Gervais. The report would be able to be provided to the person at time of inspection. It would be more easily uploaded onto our website, which we already do that, but it's basically a system of bring it back, get it approved, have it signed, get someone to upload it onto the website. And so this will save all of those steps and all of that staff time. And then also right now, if we have a very not thorough, if a lot happens at an inspection, there's a lot of handwriting. There could be, 4 pages of handwriting on these inspections. And then we post those online. So not only does the food establishment owner or manager or whomever has, the handwritten document, but also that's what goes online. And so this would all be typed out. So it would be more efficient, cleaner look. It would take out some of the steps so that it was just a lot easier of a process for everyone involved. And some of the other things we were looking at that we've been talking about for a while, trying to get onboarded, are if eventually we would be able to take payments in the field. Obviously, that's, much more complicated than just doing it because you want to have those systems of checks and balances. But we would start to have more progressive access, not only for our staff, but for the people we're serving out in the community.
Brandy, you did such a good job.
Thank you, Kathy.
Of course you did. I'm glad to hear that that's moving forward, because that was one of my things when I first joined the board that I was very interested in, because I think the technology of doing it, the way it ought to be done versus the way it's been getting done, I think it'd be very beneficial. I mean, you have a business, you can understand how doing things with technology can be much more beneficial. And I think it will tremendously relieve the burden of the staff, being able to do their job a lot more efficiently and
Faster.
and not only that, one of the things that we had talked about too was if you have a follow-up inspection or something like that and a different inspector goes out, they can pull up that information instantaneously while they're at establishment, instead of go back and get somebody's records because
Well, you
they're on
can't read it.
vacation or whatever, you can't read it.
You can't read it.
I think I'm excited to hear that, that's moving forward.
He was
I
excited.
think that'd be great.
All right, moving on to employee recognition. We have September anniversary. Karen Shiflett, 27 years. Wow. Deb Martin, 24 years. Dr. Yasinaga, 10 years. Hannah Harmon, 8 years. Jacqueline Irvin, 8 years. Melissa Woodard, 7 years. Lakia Funches, am I saying that right? 1 year. And Dave Wassercraig, 1 year. Hopefully I didn't slaughter anyone's name. If I did, forgive me, please. But we appreciate your commitment and service, so thank you so much. Moving on to old business.
So American Rescue Plan Fund update, I put that on here in hopes that I would have some more information. I don't. So I did want to just let you know, though, I did reach out to the county just to ask when that next meeting would be. So I spoke with Kevin Greenfield about having some other ideas to add to our wish list that was requested from the county. He did let me know, we can attend and kind of, give our pitch for what we would like to have funded through that. So I'm just waiting to hear when that is scheduled. The last thing I knew is that there wasn't one scheduled. So I'll let you know if and when I do hear more about that. That's all for that.
Budget process schedule.
Okay, so I sent an email out to all of you just to let you know kind of what progressed last week with the finance committee meeting. I don't know if you all have had the chance to read that. I don't want to go all the way back through it unless you want me to, but there are a couple things I want to hit on. So as you know, on September 7th, we did have our finance committee meeting, which did approve the budget. And then we did have our full Board of Health meeting, which also did approve the budget. On Monday evening of last week, we did bring that to the finance committee for our hearing date. And I did start to present it. So, and then during my presentation, the board chairman did stop me and just basically said that he had gotten an email from Jeff that he had some questions and concerns about the budget and he didn't feel comfortable allowing it to be, voted to be approved that night basically. And so it was voted to table it and then just basically, get with Jeff to answer any questions and then bring it back to you all. So Jeff and I did meet and then Sheree did produce several additional reports that were requested as far as summary report. We can go over those, but I did just want to let you know, at that point I asked, what's the next step with our Board of Health? Because they've already approved it and it, was approved by majority of quorum. So we don't necessarily, or I should say, you don't necessarily have to vote on it again because you already have, but this is going to be the discretion of the board and how you want to handle it. I did go ahead and put it on the agenda so that we were able to vote because if it wasn't there, we couldn't vote on it and I didn't want to delay this process anymore. The budget hearing that we have been asked to come back to is October 4th. So we will represent, I think, what I already did and then do the rest of our presentation and then hopefully get it voted through at that finance committee level. But we did meet with Jeff the very next day and went through a couple things, met for a couple hours and were able to talk to him about quite a few things. And Sheree whipped something up right in that moment to kind of start on as a draft for all of you. That would be a summary type of report. So that was emailed out to all of you with kind of an update. So it's really up to the board on how you want to proceed. If you have any questions, Sheree is here and hopefully can answer anything. I trust that she can, and if she can't, then we'll get you what you need in the future. But hopefully this is helpful. I do want to just reiterate what we turned into the county, those worksheets, if you remember, this thing here, this is what is required by the county. So whatever setup that is, that's what we're required to use. The summary report, this is just something that Sheree's been doing for years as like a supplement, just to make sure that board members, whether here or at county board level, know the big picture of what the bigger impacts on the current and future fiscal year's budget were going to be. So that's like an above and beyond thing that she has done. I'm very grateful that she then also did these reports, and I really hope that that gives those of you that had more questions the information you were looking for. But I did just want to let you know that the sheets we use are what we are required to use, and this is what other county departments submit and get approved through the county board process. So I don't know, did I miss anything that I should make note of before we proceed?
I mean, there was a change to the original budget document. As I was comparing the numbers, I noted that the FY21 actual amounts included were as of May 31st, which is what the auditor's office included because they did the report at 50% through the fiscal year. So we did have we had the contact tracing resolution and the mass vaccination resolution that went through in June. So I spoke to Carol Reed, the county auditor, and asked her if she could update the FY21 amounts so they would properly reflect what is in our current budget. So she did update that as of 8/31.
Yes, and a thank you to her too, because obviously that's a part that they fill out at the county auditor level, and she did that as quick of a turnaround just so we could get it out to all of you. So thank you to her as well.
So this budget line item report that you put together, that's what I was asking for. I'm appreciative of you putting that together, but I'll have two comments about this, and I'm going to leave this alone. Is number one, this, looking at it from a business perspective, is very important because it gives me an overall picture of the entire department as a whole from a revenue and expense standpoint. But the other issue that I had, and I think Jeff kind of reiterated that in his concerns, is we knew for 30 days that we were going to be having a budget meeting, but yet we get the budget put in front of us and we're supposed to make a decision in the course of less than 2 hours. And I would request that moving forward of the finance committee and of the administration, that the board is provided this information to digest it, review it, and prepare any questions that they might have, send back to the administration to get answers. Because I will say Brandy has been very, very good about responding to me. I don't know about other board members, but anything I've sent to her, she's been very quick to respond. I sent her an email the other night, and like 30 minutes later, she fires me an email back with answers to most of my things. So I guess I have that expectation of that level of response. So I'm a little disappointed that we got a budget to look at, right before a meeting. And I would really appreciate it going forward, because we do get these other reports in advance of meetings that we have this information. And I would just like to move forward from here and say that's something that I would like to see next year. Because this is a lot to take in. It's a lot to absorb. And as I said the other night at the finance committee meeting, we've got relatively almost half your board is brand new board members. So we're kind of, getting in the groove of things here, so to speak. And so to get a document with this much information and to try to absorb all this in that short time is difficult. And that's why I voted against it last meeting. I mean, that's my primary reason, because I did not have time to look at it. I still haven't absorbed it 100%. This helps a lot. If I'd had this prior to the meeting and could have looked at this, I probably would have been okay with everything. So.
Well, I'm glad you brought that up. Mark did, as he said, and if you read the finance committee meeting minutes, he was there and he did stand up and voice these concerns. And I will say what I said at the finance committee meeting. I totally understand. I take your feedback, and we can definitely make that edit next year, because we always know the budget is coming, right? So it's not a surprise even at 30 days. What I will say though is just to advocate for myself and my team is that the people working on this very budget are the same people that I've been telling you are working day after day, all waking hours of the day. I mean, an amount of hours people are working, I'm not making excuses, but I'm just keeping it real with all of you, the way that things are here right now, and having to cover everything, that getting the budget ready at all is very challenging with all of the expectations for us with our essential services plus COVID-19 related. So we take your feedback. We can definitely get it to you all early next year, and I respect that for sure. But I do, like I told the finance committee, you know, we appreciate any grace and patience that you can give us in this extremely hard time. You know, that was not a neglectful thing on anyone's part or a procrastination thing. It literally is like you constantly have things to do. And the reason I respond, you know, within 30 minutes in the night, or that any of my staff do that, because I'm not the only one, is because we're working, because we can't get everything done during each day. And so but next year we will definitely address that, and we will make sure that you have it a little bit earlier. I think I may also request one of the later hearings from the county in the schedule, so that we do have a little bit more time, because we do have year-end fiscal for the state, which is June 30. So everything that has to be done after that time period, around the same time that budgets are being worked on and due, is an excessive amount of work. And I think I've also shared with you all, not just with Cherie, but any division, you know, we're doing everything we can to hire staff or implement succession planning, so that it isn't so much on the division directors or on, you know, a few people in the organization. But in a pandemic, it's kind of just how it rolls out. Or if someone leaves, which we've had people leave in key positions that we all have to then cover, it unfortunately is kind of just how it's been. So thank you for your grace and patience, and we will make that edit for next year.
I also want to thank you for putting this together and to being receptive to my comments. In my heart, I have a feeling that those are good numbers. And in talking with you for the last 6 or 8 weeks, I know that you have tight controls, but to be able to see this and put it all together, and to be able to support you all in the EEHW and the county board is important, and it rests heavy on me. So I appreciate your gracious help and quick turnaround for us to sit down and talk about it. Thank you.
Are you still working on the budget right up to the minute that we can get to see it? I mean, are there some changes being made like days before, or like right up to the?
Well, changes are generally made, and I will say this year, usually it is done, you know, maybe a few days in advance, but then we're using the rest of those days to prepare presentation, to go over things, to make sure that we're both on the same page with everything. Luckily, we have a CFO here. A lot of county departments don't have someone like Cherie or with the experience that she has, so thankfully she can whip up all this kind of stuff, and I'm very grateful for that. But I mean, this year, yeah, definitely, it was a different thing.
A few days ahead of time. I mean, you're only a few days before we see it. You guys are.
Oh yeah, it was being finalized, you know, up through that day, and oh, you know, if there needs to be a tweak or something made, and again, I will fully, you know, that was definitely me, and I said to Cherie, we might get, you know, someone that isn't happy or people that aren't happy to receive this, but I will explain that, and I, you know, as the leader, obviously I'm the one that has to own that, and I see what's happening. And I, you know, and in admin, we lost our 2 administrative assistants this summer, and like, who do you think covers that? The same people doing the budget, you know, and so I'm not, again, making excuses, but I can't just say, oh yeah, we just wait till the last minute. That is not what's happening here.
With us not knowing how a budget works, I mean,
Yeah.
a big budget like that,
Yeah.
is it like days, or that's what I was asking, if it was just like a few days ahead of time where it's, hey, we're done, but we're still making changes, or, you know.
I mean, it's right up to it, and sometimes things happen that you find out, and you know, the budget's ready, you know, ready to go, but we're, you know, just checking things, making sure there's no errors or anything like that, and there might be something that happens that week that it's like, oh, we need to significantly change that for whatever reason it might be. I mean, for example, okay, something like now we need security again in our building because people are coming in here berating our staff, physically trying to get close to our staff and things like that. Well, now we have to get the sheriff deputies more again. So something like that can drastically change, where we need to move that or add that's happening literally right down to the minute. But I do feel like, okay, next year, if we give it to you a week in advance, let's say, or the 48 hours or whatever, if something drastic happens, we'll bring that to you during the meeting and say, we would like to make this change, this is why, and then you at least have the budget package in advance, and if there's last minute changes that we made, we can hopefully just get that approved at the time of the meeting.
Well, and I would say too, in the same respect, you know, I think the board would be understanding and gracious enough that if you said, hey, a week out, we've got some front burner issues going on here at the department, we're not gonna be able to complete this, to be fully prepared for the meeting coming up. If we have to reschedule a meeting, to make it work for you guys to have everything completed and still have us the time that we need to review everything, I'm okay with that.
I was gonna make that,
Because I don't want you guys to feel like you've committed yourselves to a date and your back's against the wall till 11th hour trying to put the thing together.
Well, the county
I'd
does
rather give you
commit
more
us to
breathing
it.
room, you know what I'm saying?
Yeah, the county does commit us to a date though. That's why we had to have a special meeting, because our original date was, I don't know, it was earlier, it was tonight. So we had to ask for a different date for our hearing. So, the county has X amount of hearing dates and you have to fit into one of those. So like I said, next year I'm gonna just try to get in the very last one to give a little bit more time for all of us. But we are kind of cornered, which is why we had to have that special meeting to go over the budget in the first place, because we had to get it done before our hearing, so.
Okay, so do we want to approve the budget again, or do you guys?
I don't
Okay,
think we need to
just
take
leave
any
it?
action.
All
I
right.
think we've reviewed what our concerns are, and I think Brandy, Shreya's has addressed those. I'm satisfied. I'm just, like I said, I'd like to have this information 2 weeks ago.
You're good, Tim?
I am, and I will, in fact, we'll be at an EEHW meeting on Thursday. That'll give me some time to look at this and ask any questions, and we can report at that point.
Yes, and if anyone would like to attend the finance committee, feel free just to, if I need additional support that yes, our board, did approve this and did feel comfortable with it, I would be open and thankful to that.
Would you like for us to be there?
I mean, if someone could come, I think that would be nice.
As I told you before, I'll be there.
You're gonna come to, okay, October 4th, yes, October 4th.
What day is that? Thursday?
I think it's a Monday. I don't even
It
remember.
could be 5:30, but I might.
And thinking it might not even be able to be over a certain amount of our board members because of open meetings, because board business will be being discussed. So, I mean, you all won't be discussing it, but there might be a fine line there. So we would be able to have 3 people there total. So, yes, we'll take support, but I don't know, speaking off the top of my head, it might only be able to be 3 worth of you, yes. And I don't want you violating OMA, which by the way is still not, so I did check that. All right, so are we good on that then?
Yes.
All right, so email addresses?
Email addresses, that stuff did get passed out. Dr. Miniganti, I do have yours in my office that I could get to you. I only have a couple people that have gotten theirs signed up that I've gotten emails from. I know a couple of you had trouble. Evan was off last week and we strongly encouraged him to be off. And so if you need assistance, he does know that some of you might need his help this week. So please feel free to reach out to me or him, and he or Fred can help you get set up. But other than that, we have a couple of you and they've been updated on our roster and on our website.
Oh, we were supposed to send an email.
Just when you get confirmed, yeah. Are you good? You set up?
Yeah,
Okay,
I'm fine.
good. We'll get yours changed then. Yeah.
All right.
So now all of the correspondence will come through our new emails?
If that's what you prefer. If you prefer something else, we can do what you would
I
like.
prefer that,
Okay.
not my county board. It's good separation, it's a good tool. Glad to have it.
Okay, new business, salary assessment.
Yes, so I have a document for you. This is nothing you're voting on, so I realize I'm just bringing this to you, but this is really just an FYI. We can continue to discuss this however many months you want. This is the salary assessment summary report that we talked about last month that I told you I would bring to you. I'm gonna pass it out and I'm gonna make some points about what's on here. Sorry. Are you guys cold in here?
Yeah,
Did I try to
we talked about that when we first came in here.
Okay, so this document, if you recall last month, and if you've been on a while, we've talked about this, but one of our goals actually of 2020, but I obviously had to delay it, was to complete a salary assessment. The last time the health department did it was in 2014, and it showed that our levels of pay were significantly lower than comparable employees. At that time, this really, wonderful salary assessment was developed by a professional company at that time, and we were up to 25% lower than comparable employers. And so there was a plan put in place by the board and administrator at that time to increase levels of pay with current employees and also levels of pay for incoming employees. So over time, and we had support from the county board with that and encouraged us to continue to work on that so that we could recruit and retain staff. So our goal, like I said, was to do another one just to see where we're at. Did we make the progress that we wanted to make or not? There were no professional companies that we could access over the course of looking for a company that could do what we wanted and what we needed. So we exhausted that option. So what we ended up doing was partnering with IAPHA, which is Illinois Association of Public Health Administrators. It's just an association of administrators. We network, we share information, et cetera. And a lot of administrators were working on finding salary assessment information and data. Of course, nobody really has time to do that with everything else that they have going on. And so with the intern that we had, this is one of the assignments that we had her work on. So IAPHA had already developed a survey to obtain this information. It was not developed by us, but basically we just offered for our intern to assist with getting all of the data into spreadsheets, reviewing the data, coming up with some ranges, et cetera. And so that is what has been done. What I will say is this only represents health departments. This does not represent hospitals or FQHCs or long-term care facilities, which generally.
It's not all health departments.
It is not all health departments, you are correct. It is only the health departments that responded to the survey. So you are not seeing, honestly, the whole entire picture with this, but this is the best that we could get right now. Now in the future, if we can obtain a professional business that would be able to do this for us, and that would be fantastic. And then it would be more of a comparison directly to the old salary assessment. But this is really the only thing that we could access to bring back to the board with any kind of information or something to help drive decisions that we were making about pay. And so another thing too that I want to note is that anytime that you compare health departments, whether it's salary or anything else, it's never apples to apples, as they say, because local health departments are very different. They have their core essential services like your local or comprehensive health protection grant programs, but then they have all different types of things depending on what type of facility it is. You might have a health department with 3 employees and you might have a health department with hundreds of employees. So when you look at these numbers too, you're going to see counties, of all sizes and counties with all numbers of staff, counties with roles that are not directly comparable to one another. And so I'm going to tell you the information here is as good as what's been given to us without really having a direct comparison to an exact alike health department. So what I did with all of the information that the intern had brought together was I just combined all of the other counties, low and high end. You'll see some blanks there. And for those roles, we couldn't really find directly comparable roles to put in there. What I would say for most of those, especially your, 1 through 4, 1 is where we used to have people that would have been about at the minimum wage point, but we don't even have level 1 people anymore. And we don't currently have any 2s or 3s. And so that is why some of those are blank, just so you know. So you'll see in the low end, that's the lowest end. So you're probably looking at your smallest health departments, fewest programs and services, not a lot of supervisors, stuff like that. High end, obviously, that's going to include even some of your counties that'll be like DuPage County, for example. So that's why you're going to see this really, really different amount from your low to high end. Macon County base pay, based off of current, that is the information from the pay grade scale. If you remember that from last month that you approved for FY22, these are the current rates of pay, and that is base pay. So that would be anyone coming in at any of those levels, that's what they would definitely come in making at the health department. And these are full-time rates. If you remember, part-time is plus a quarter per hour because we don't pay for benefits. So then Macon County current employee salaries, I'm sure you did some reports for me for this too, just to determine where we are at low end and high end for anyone in that entire level. So when you look at some of these levels, you see people that have been here a year, you see people who have been here a month, you see people who've been here 20 years. And so that's why you also see a great difference sometimes in levels of pay versus what level someone is. Like if someone's a lower level, but they've been here 20 years, there's a chance they might be a little bit above a higher level new person, if that makes sense. And so this is some of the information that I used when I came back to you and said, you know, this is what we'd like to propose for merit plus cost of living raise plus that base pay adjustment of the 2% to keep us in there. If you recall from last month, I did talk about the only one that maybe is not as high is if you're looking at that level 8 line, especially when it comes to some of our nurses or higher professional level staff that maybe have, you know, an RN or a bachelor's degree or equivalent work experience. But again, it does fit in that range, which is why we did not make any kind of super significant change in that level versus what we did at 2% for the rest of the levels. So I'm open to any questions. Like I said, this is really not the full picture. And I do hope that eventually we can get a professional company. If anybody ever has recommendations, we could not find one that was able to fit the need that we had, but we wanted to bring something and at least have some kind of information to drive the decision that we made with salaries this year.
Questions? Thank you, Judy. Personnel manual.
Okay, so this, as I stated in the email or had Lakia add in there, each year we review the personnel manual at least once a year. If there are changes that have to be made through the year, then we may bring them through the year to you. If there's an emergency policy change that needs to be made, I do have the ability and authority to do that for our policy manual, but then still that would be brought to the board. And so we don't have any significant changes. We did have our health, equity, diversity, and inclusion coordinator go through and make some edits to pronouns that were used to make our policy manual more inclusive, but we did not make any policy changes in there. So I still wanted to go through the process since it does say that each year for policy, we will review it and bring it to the board. We don't have to do anything with it until next month, but again, I wanted you to have it in advance so that you did have time if you really wanted to read through it and make any recommendations or ask any questions that you have adequate time to do that. So I'm happy to answer questions now, or if you take some more time with it before next month, happy to answer questions in between our next month's meeting. I do think that just because there was that change, if there was any change made at all, I do feel like it would be okay to vote on it next month if the board is agreeable, just so we're going through the process that it says we will in our policy manual. So I'll just stop, and any questions I'm open to.
I'm assuming this has been reviewed by the attorney.
Oh, yes, that's a great question. Yes. We always, whether it's a new policy or just, you know, any change that we've had to make with the pronouns, we did not because that was just an inclusion change. But any other policy, we always have legal review it. I also do talk to, and we work with Ed Flynn, who does the HR legal for the county. I do talk to him a lot. And if even with implementation of policy, we ask a lot of questions because, for example, with the mandatory vaccination and mandatory testing, we had a lot of questions about implementing it correctly and do they have to do it on paid time and do they get mileage and things like that. So we ask him a lot of questions because, like I told you, I do want to make sure we're doing things right and we're not positioning the health department or the county in a spot of financial liability. So yes, the whole thing's been reviewed, and then when we've added or updated policies, those have been reviewed as well.
Any other questions? So we have plenty of time before our next meeting to review thoroughly. Great, thank you. Homework contract.
So I did put this in your packet just so that you would have time to look at it. I just sent it to Mike Baggett on, I think, Friday. So I don't have anything back yet, and we then should not vote on it tonight. But I did want you just to have it. You can start looking at it. If Mike has edits, I'll give you the updated version of whatever he changes. This is for maintenance of our new freezer units, has to be done, or obviously can be dangerous if they're not maintained correctly. And so this is going to be a multi-year contract so that we have a locked-in lower rate. And if you have multi-year contracts, that's one of those situations that I mentioned that we do have to have that approved through legal and then through all of the Board of Health, EHW Finance, Full County Board. So we'll have a resolution ready for that, plus hopefully an edited contract by next month. So we can move along. It's not, I think it's not due until maybe November, so hopefully it'll move quickly. That's it for that.
Appointments to committees.
Okay, so this is something that we've talked about having to do coming up because we have had some people go off the board that were in positions on the committees. Some of the standing committees, or all the standing committees, are nominating, finance, personnel, and bylaws. I did put it on the agenda so that it can be voted on tonight if you as the board choose to do that. If you don't, you can basically, talk through names and then do the vote next month. That's obviously all up to you. But I did prepare kind of a list of what is vacant and who's in what positions, just so you all can discuss. So the nominating committee, right now it has Jan and Dr. Minaganti. And then there is a vacant spot. And per the bylaws, that committee should be 3 people. So we definitely need someone in that role. The other committee is finance. That already has 3 people, so there are no vacancies, and that is Vivian, Candy, and Sue. Personnel committee has historically had 3 or 4 people based on previous years' rosters. It's fluctuated. Right now we have Vivian on there and Sue, so that could have 1 to 2 people added. And then the bylaws committee has 2 vacancies. Right now it has Dr. Minaganti, and then of course the 2 vacancies. So lots of opportunities for people to volunteer. The executive committee, obviously, the people in the officer positions, Vivian, Mark, Sue, and Jane.
So I can come off of something. If anyone else wants to speak.
So you just read this off, but I mean, you don't have anything typed up with a list of names or openings, because I'm looking at on nomination committee, you literally have 2 openings, bylaws, you have 3. That's what I'm looking at.
If there's 1 opening on
nominating and 2 on bylaws.
and 1 or 2 on personnel.
So do we pick them or does somebody pick them?
No, you as the board pick them, so you can
So you
volunteer.
can pick someone you think it would be good at that. And
Well, according to the bylaws, the president's supposed to appoint people to committees. Correct?
Well, in the past, the way that we've done it is, obviously there's discussion and if someone wants to volunteer, et cetera, and an appointment, but then there's a full vote for it, is what we've done in the past. What I will say, I mean, I can put them on a list, we keep them on a roster, but I'm happy to do that if you want me to before the next meeting. But we generally do a vote to vote those people in. These are vacancies because people, obviously their terms ended. So these positions, the appointments would then happen again at the December meeting per the bylaws. So these positions basically are gonna be filled for a couple months. And then obviously someone could be reappointed at that time, but then we will be talking about this again in a couple months.
So if we're gonna,
I can do bylaws.
if we're gonna reappoint people 2 months, are we gonna reappoint people that are already in those positions, or are we gonna have a whole new slate on each committee?
That's up to the board.
What's been the process in the past?
Before, generally, if someone was on a committee, they stayed on that committee unless for some reason, if they had a, conflict of their time or something that came up that they could no longer serve in that role. But we did have a lot of people who had been on the board for a long time and they were in the committee that they were on would stay in that. Off the top of my head, I can't remember. I know that the officer positions have like term limits, but I can't remember on the committees. I could check that, but anybody being appointed this month can be reappointed in December. If it's not gonna be like a 2-month commitment and then everybody has to shuffle again unless the board chooses to do that. I'll double check that I have.
Well, I guess my question is, if we're gonna revisit this in 2 months and we've got a small number of vacancies now, do we even wanna deal with this right now? Or do you wanna wait? I would say it's the president's discretion.
Well, if anyone who wants, if anyone wants to volunteer, like, Dr. Durger is willing to do bylaws, so.
I'm not sure about the bylaws, but this, for years it has been done in 1-2 basis. Who are opted to spend their, give their time. They're part of the committee.
Yeah, 1 year, so, which would be why we do it every December, so. But it does not state that there is a term limit, so again, if somebody started this month, or if you wanted to wait, I mean, that's up to the board. The only pressing thing at this time for the committees would obviously be, executive, which is not necessarily a committee, but it's the executive team. Because the other stuff was moved to May or June. And then my evaluation, which we'll talk about in close tonight, but that the executive committee does that, and the executive committee is already full. So if you all want to wait till June, up to you, but I don't see any problem with that.
Who are the executive committee?
That is Vivian, Mark, Sue, and Jan.
So.
I'd make a recommendation that we wait on the committee assignments since we're only 2 months down the road. And the other concern I got, which I don't know how we want to bring this up tonight, at what point, but part of the requirements in the bylaws is that board members be active at board meetings and also being involved in committees. So that's why I'm looking at some other openings on some committees that we aren't really considering right now. And we can have the discussion tonight, or we can have it another time, but I think that needs to be addressed as well. Because you're supposed to be actively on the board, you can't be active, if you're not active on the board, you're not active in a committee, then you probably shouldn't be on the committee then.
Well, I would prefer that people volunteer. I mean, I could appoint, but if I appoint you to something that you're not comfortable doing, then what's the point of doing that, right? So.
I would appreciate if staff could put together a list with the committees and a breakdown of who's on those committees specifically for us to have a review, and then maybe come back next month with some nominations and vote on next month or the following month. I think it would be prudent to give everybody time to volunteer themselves.
I can do that.
Anything else before we move into closed session? No. All right, so I need a motion to move into closed. You get that, Lakia? Aye.
Good night, everybody.
Good night. Thank you. Okay, so.
Hi, is the live stream off? I'm ready, go ahead.
Thank you. Okay, roll call for open session.
Here. Vivian Goodman.
Here.
Jan Hack.
Here.
Debbie Hill.
Here.
Dr. Ben Captain.
Here.
Mark Scranton.
Here.
Dr. Brett Jordan.
Yes.
Cody Parks.
Yes.
Jeff Edler.
Yes.
Okay, we don't have anything to vote on. Did you have anything else, Brandy, that I needed? Okay. Nothing else, I will entertain a motion to adjourn.
I second. Let's go.
Did you make a motion?
Oh, I
She made a motion, I'll second it.
I thought you said I'll second it.
She did say that, she did say that.
Vote, please.
We're gonna put
My
words-
brain's not working.
Candy Clevenger. Vivian Goodman.
Yes.
Jan Hack.
Yeah.
Debbie Hill.
Yes.
Dr. Brett Jordan.
Yes.
Dr. Ben Captain.
Yeah.
Mark Scranton.
Yes.
Cody Parks.
Yes.
Jeff Edler.
Yes.
All right, thank you,
Thank you,
everyone.
everyone. Take care, be safe.
I know you're thinking that we're supposed to make a motion to.
Boy, I love that, I like that, Jack.
I'll tell your dad on you.
Pretty stuff.